Physique offer a wide range of bolsters, pillows and cushions. Today we're going to be taking a look at the memory foam face cushion, the whole round bolster, the 3/4 round and the half round bolster, as well as the bolster pillow. But why so many different sizes, and how can we use these to be more effective as therapists and to keep our clients comfortable? My name's Liam Coffey from Muscle Doctor, and today I'm going to show you how. So let's begin with the bolsters. In the prone position or face down, we place the bolster just underneath the front of the ankle. This elevates the legs slightly and it tensions the patella to stop the kneecap from wobbling around with the legs face down. We can use different sizes depending on the client's size or how high we want the leg elevated off the couch for that particular treatment. In the supine position, so with the client face up, we place the bolster underneath the knees. This tends to put the lumbar spine in a more comfortable position, and we can use different sizes depending again on the client's size and how high we need the legs elevated for treatment. So this would be the standard use for these bolsters, but how else can we use them to make us more effective as therapists and in positioning our client for treatment? The side lying position can allow us to utilize treatments into the lateral and medial portions of the leg a little bit better than perhaps in supine or prone. But how do we put the bolster? So there are two ways really to put the bolster. I prefer to do it in the way with the hip flexed, knee bent, leg up on the bolster, but we can also swap that around. So the top leg is straight with the bolster underneath. Individual preference comes into play and also your needs for that particular treatment. So try both and see what works for you. An alternative use for the bolsters is to place it lengthways down the spine with the client in supine. To do this, we're going to pop the bolster up against the sacrum with them seated and then encourage them to lie back. We can use the half round bolster initially, or we can go to 3/4 round, but just make sure you've got that flat edge, so not the whole round bolster, so that they've got that solid base to lie back on. And you can get them in a nice stretch position, either for treatment of the pecs and anterior neck, or for METs and STRs, for areas such as pec minor, pec major, and the internal rotators of the rotator cuff. The bolster pillows are perfectly designed to emulate the lordotic curve of the cervical spine. So with that in mind, I like to place the bolster end underneath the neck with the head then lying on the flat part. But we can also use these by flipping them around and getting the person to lie their head on the flat part. That will then give us space underneath the back of the neck to do some good work with massage and other techniques. An alternative use for these pillows is to place them underneath the arms in the prone position. So I might use this for somebody with shoulder pain, mid-back thoracic pain, or just to generally address poor posture with hyperkyphosis of the thoracic spine. You may use this for the target arm, or we can use it for both sides. Just check that the client's comfortable and that they're happy in this position. The memory foam face cushions are an absolute must for me, very comfortable, and they help clients to avoid that telling red ring around the forehead that shows that they've just been through a treatment. Physique also do the paper towel coverings to keep things hygienic and clean.